Astellas is a company that has as a core value the patient at the center of all of its thinking and everything it does. So Astellas is very well positioned among pharma companies to integrate a more formal and mature form of patient centricity. This idea that we can create real processes that are sustainable and reproducible to incorporate the patient more fully into new drug development and into the culture of Astellas as an organization and as a global company. I'm Anthony Yanni, Senior Vice President of Patient Centricity at Astellas. I began my career as a clinician. Some 2 decades ago, I spent a great deal of time in the exam room working with patients and listening to patients. And what I found was that despite being able to offer several therapeutic options, oftentimes patients weren't satisfied with the result. 10 years ago, I joined pharma and I took that message with me. I realized that there has to be a better way to incorporate that patient perspective into new drug development. And that's, for me, where the idea of patient centricity was born. Patient centricity is a fundamental part of how we develop the next generation of medicines. But for any organization, 2 components are necessary. First is cultural. Every employee in every location and in every task has to have a conscious awareness of the patient. And second is an operational approach. We need to integrate that patient component in all activities. We need to change the infrastructure so decision-making includes the patient component in a consistent and reliable way. Pharmaceutical companies, in order to integrate the patient centricity activity, we need to constantly remind our team members of the importance of their work, that everything that they do every day is for the betterment of our patients, to provide better treatment, provide better care. And if we can do that, we know that every day we'll be closer to a solution for our patients, for their caregivers, and for our providers to deliver in the real world setting. One of the things we're focused in on is evolving from treatment to care. We know that science linked to disease can provide treatment options, but we also know the patient in the real world also has multiple symptoms that may go beyond the disease that we're treating. So understanding that patient in their environment is key to transitioning from treatment to care. So the main focus of the Patient Centricity Division is to create capabilities to engage patients globally so that a diverse population of patients can provide their insights, and then to create vehicles internally to make those insights actionable. And in doing that, we support internal teams as they develop the next generation of medicines. Astellas, as an organization, has always shown its commitment to the patient as a focus of all of their activities. But the fact that Patient Centricity Division exists shows even further their commitment to understanding the patient, to utilizing their insights, and developing the next generation of medicines with patients. I think the future of patient centricity has to follow some of the other more mature support functions that exist within pharma. So if we're successful in our work, I think the future of patient centricity will find it as an essential function for all new drug development, so that no pharmaceutical company will ever think of developing a medicine without having the patient involved and without collaborating more fully with the patient, the caregiver, and the physician. We're excited at Astellas with the work we're doing, and we're excited about the future of a patient-centric culture and a patient-centric approach to new medicine development.